Infertility. This is the inability to get pregnant and have a successful pregnancy. This is typically diagnosed after an individual has tried to get pregnant for a period of 12 months through unprotected sex. This is an overview of infertility in females. Causes may include hypothalamic amenorrhea, fibroids, pelvic inflammatory disease, PID, hormonal imbalance, presence of polyps, polycystic ovary syndrome, PCOS, abnormal cervical mucus, cervical stenosis, Athmanis syndrome, adenomyosis, endometriosis, blocked tubes, genetics, idiopathic causes. Welcome to SR Medicine. Don't forget to subscribe, notification button, like, and also share. Types of infertility. At least 10% of women deal with infertility of some kind. It may be primary infertility. This occurs when the couple fails to have any child. It may be secondary infertility when they have one child and they find challenges to conceive. Female factors, they usually account for 30%. They may include hormones, egg formation, implantation, pregnancy. Male factors, also 30%. They may be related to hormones, formation of sperm, spermatogenesis, erection, or sometimes difficulties with ejaculation. Unknown factors, idiopathic, 10%. However, both male and female factors that may cause infertility they account to 30%. Usually, chances of conception always increase with having unprotected sex for a period of 12 months. Any fertile couple must conceive within the first year of regular. Before we dive into the causes of infertility, let us see what occurs after ejaculation. That is during fertilization. We have the vagina, the cervix, the ovary, the endometrium, and the fallopian tubes. Once sperms are deposited in the vagina, they cross the cervix to the uterine cavity. They swim via the fallopian tube, and somewhere here they have to meet the egg which has been released by the ovary. The ovary releases the egg. The egg travels via the fallopian tube and finds the sperms. Fertilization takes place here to form a zygote. The zygote then has to move backward via the fallopian tube and has to implant on the endometrium wall. Implantation. Therefore, some of the factors which may interfere with this process may cause infertility. Let us dive into these factors which may interfere with this process. Ovarian disorders, for example, polycystic ovarian syndrome, PCOS, that is the presence of excess male hormones, androgens, also known as hyperandrogenism. This inhibits ovulation. It causes anovulation. Characteristics of PCOS include excess facial hair, irregular periods, increased LH, high BMI, that is obesity. Therefore, polycystic ovary syndrome, it is a triad of anovulation, polycysts, and also hirsutism, excess hair, usually in females, facial hair. Also, another ovarian disorder, premature ovarian failure. This is the cessation of menses prior to the age of 40 years as a result of depletion of primordial follicles. Here, what takes place is that there is always depletion of eggs. Eggs get depleted at an early stage before 40 years. Causes of premature ovarian failure, they may be genetic factors, autoimmune diseases, radiotherapy and chemotherapy, surgery, and toxins. And sometimes it may be luteal phase defects, insufficient progesterone. Pelvic, tubal, and uterine disorders. Example is endometriosis. In endometriosis, the endometrial tissue develops outside the uterine cavity, which causes excessive bleeding and painful menstrual periods. Sometimes also it may be tubal blockage. That one does not allow movement of sperms and also the fertilized egg. Then fibroids, uterine adhesions, Ashman syndrome. Those ones prevent implantation and sometimes they may interfere with the movement of sperms. Abnormal cervical mucus, cervical stenosis, that is a narrowing of the cervix, can be caused by uninhibited malformation or damage to the cervix. As I've told you that sometimes the cervix can't produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. That is abnormal cervical mucus. Adenomyosis, this occurs when the tissue that normally lines the uterus, that is the endometrial tissue, grows into the muscular wall of the uterus. Symptoms of adenomyosis, sometimes it may cause no signs or symptoms. However, some of the symptoms may include heavy or prolonged menstrual periods or bleeding, severe cramping or sharp knife-like pelvic pain during menstruation, dysmenorrhea, chronic pelvic pain, dyspareunia, that is painful intercourse. Sometimes the uterus may get bigger, usually tenderness or pressure in the lower abdomen. Hypothalamic amenorrhea may also cause infertility. It is caused by physiological stress. Physiological stress is brought about by psychological stress or lifestyle stress, extreme diet, reduced BMI, chronic disease. Whenever there is hypothalamic amenorrhea, this inhibits hypothalamus. Therefore, no secretion of follicle-stimulating hormone, no growth of eggs, no secretion of luteinizing hormone, that is LH, therefore no ovulation. Another cause may be hyperprolactinemia. This is the overproduction of prolactin. It is a breastfeeding hormone. This hormone inhibits the production of gonadotropin-releasing hormone from the pituitary gland. Characteristics of hyperprolactinemia, they may include galactorrhea, that is breast milk, a milk nipple discharge, which is unrelated to the normal milk production of breastfeeding. Amenorrhea, reduced libido, headache, cranial nerve pulse. This is caused by pituitary tumors, prolactinoma. They are the cause of hyperprolactinemia. This is excess prolactin in blood. Now the hypothalamus always secretes gonadotropin-releasing hormone that travels through blood to the anterior lobe of the pituitary gland to cause release of FSH. This is a hormone that causes development of the eggs in the ovaries. LH, it is the hormone that causes ovulation. Therefore, anything which may interfere with this may also cause infertility. Pituitary disorders, hypogonadotropic hypogonadism. Here there is under-secretion or no production of gonadotropin-releasing hormone. Therefore, no FSH, no LH, no egg development and ovulation. This is ovulation disorder type 1. It's also known as hypothalamic pituitary failure. Then there may be hypergonadotropic hypogonadism. Here, the hypothalamus will secrete the GnRH. Then the thyroid gland will have to produce excess FSH and excess LH. However, no follicles, no eggs in the ovary. This is also ovarian disorder. Risk factors. These increase the chances of infertility. Age, hormonal issue that prevents ovulation, abnormal menstrual cycle, obesity, having a low body fat content from extreme exercise. We've looked at hypothalamic amenorrhea, structural problems, uterine fibroids, cysts, tumors and polyps, autoimmune disorders, sexually transmitted infections, polycystic ovary syndrome, primary ovary insufficient, excessive use of substances, heavy drinking, smoking, a past ectopic pregnancy, may also increase the chance of infertility. Diagnosis. Watch my video on investigations and also treatment of infertility, where I dive into the details of diagnosis and also treatment. During overall physical examination, a pelvic examination, pelvic ultrasound, an examination of the breasts for unusual milk production, that is to check for the presence of excess prolactin, a pap test to screen for cervical cancer, blood test may be done, x-ray, extrasalpingogram to find out tubal blockages, laparoscopy, transvaginal ultrasound, saline sonohysterogram to check for uterine abnormalities, hysteroscopy. Thank you for watching. Don't forget to subscribe, notification button, like, share. Thank you.